Hi, Emma.
Hi.
My name is Hayden. I'm a student physical therapist at UNLV. How are you today?
Good. How are you doing?
Good. Can I get you to verify your date of birth, please?
April 10th, 61.
Okay, thank you very much. So I'll be taking you through your evaluation today. I understand you're having some hip pain, right?
Mm-hmm.
Okay. And to do that, I'll likely just need to be touching different areas of your body. So that would be mostly in this region, maybe a little bit up on your shoulders as we go through it, and then down to your knees. Is that okay with you?
Sure.
Okay. So, like I said, we'll be going through some testing today just to really see what's going on with your hip. But first, I'd like to just talk with you for a little bit, okay?
Okay.
So, first of all, are there any pronouns that you prefer?
No.
Okay. And I understand that your hip pain's been going on for a while, is that right?
Yes.
Okay. Tell me a little bit about it.
Well, I run marathons. I've been doing it for a while, and I had some hip pain after I gave birth, and so I don't know if it's because I'm running too much or what, but all of a sudden I've been getting this hip pain and kind of in the front here.
Okay, yeah.
And it just gets worse as I move with it,
Okay.
I kind of just hang out, there's not as much pain.
Have you recently increased your mileage as you've been training?
Yeah, I've got a marathon I'm training for right now.
At the end of the summer, right? You
Yeah.
want to get back to?
Yeah.
Okay, yeah, that's understandable. And thank you for filling out those forms. That gave me a lot of information about what's going on with you.
Mm-hmm.
Now, I also understand you had back pain and SI joint pain about 2 years ago,
Yeah,
and that was about the same time as your pregnancy, right?
exactly, yeah.
Okay, and it's gone away after you gave
Yeah,
birth?
yeah, everything was good. I ran a marathon afterwards, so
Okay, yeah, glad you're healthy.
yeah.
And so, also with your medical history, I understand that you've been having some headaches,
Mm-hmm.
and it's about once a month. You take medication for that.
Yep.
How is that medication working?
It works when I take it.
Okay, yeah.
Yeah.
And have you identified any triggers or anything that would lead to that about once a month headache?
No, nothing that I can think of. Maybe just stress after a long day.
Okay, yeah,
Yeah.
makes sense. All right, so I know you're married with one kid, and that you've been running a lot. You work for a shoe company, right?
Yeah.
Okay, yeah. So with your health status, how would you rate it from poor to great?
I would say I'm great. Yeah, I run a lot.
Good.
I watch what I eat. Yeah, I'm healthy.
Okay, are you sleeping well?
Yeah.
Do you smoke or drink alcohol?
No.
Okay, good for you. I'm going to ask you about a series of questions right now. I'll just go through it quick.
Okay.
So just bear with me, okay? And it's just to rule out anything that might be more serious going on.
Okay,
So,
sounds good.
have you recently experienced abnormal sensations like numbness, pins and needles anywhere down your legs?
No.
Okay. And have you recently experienced any headaches other than the one you have typically?
No.
Okay. What about any night pain that wakes you up?
Nope.
Okay. Any sustained morning stiffness?
No.
Okay. How about lightheadedness?
No.
Any recent trauma?
Nope.
And how about night sweats?
Nope.
Constipation or changes in bowel or bladder?
Nope.
Okay. Any easy bruising?
Nope.
What about changes in vision
No.
or changes in menstruation?
No.
Okay. Thanks for bearing with me through that. I know it's a
course, no
long list,
problem.
but we had to go through it. Okay, so let's get into a little bit more about what's going on with your hips. So I know you got that anterior hip vein, some muscle spasms going on just right in this region. Is that right?
Mm-hmm.
Okay. And then you also said that there's no like pins, needles, numbness anywhere down your legs.
No.
Okay. And it's 2 out of 10 at best, 7 out of 10 at worst, but after a long day. Is that with after work, after running?
Definitely after running.
Okay.
I would say after work. Yeah.
Okay. And is it the same or better on non-training days?
It's worse on training days, I'd say.
Okay. And with your current hip pain, how long has that been going on for?
A couple weeks now.
A couple weeks? Okay.
Yeah.
And how are you doing with things like stair climbing at home? Do you have any limitations such as taking care of your child?
Stairs kind of hurt when I kind of bring my knee up.
Okay.
It's just not very comfortable.
Okay.
But other than that, just if I get into like a crouch position, maybe that kind of flares it up a little bit.
Okay.
Yeah.
And you mentioned that getting off the floor was hard, so is it like picking up your child, things like that?
Yeah, things like that, like bending and twisting a little bit.
Okay, yeah. thanks for that information. That helps get kind of a snapshot of what's going on in your life and how it's affecting you. And so now what I'd like to do is we're just going to get you moving, okay?
Okay.
So go ahead and stand up for me, please. Do you mind just walking down there and just straight back? How's your hip feeling there?
It feels okay.
Doing okay?
Yeah.
Okay. Good. And now let's put hands on hips. Go back like this. Okay. Any pain?
A little bit.
A little bit. Where is your pain?
Oh, in the front of the hip.
The front of the hip. Okay. Go ahead and bend forward all the way down. Any pain there?
A little bit in the front of the hip.
Front of the
there,
hip.
yeah.
Okay. Now let's go like this. Rotate to your left. Any pain there?
Nope.
Okay. I'm gonna push a little bit. No pain?
Nope.
Okay. Other side. No pain?
Nope.
Okay. And now let's go hands on hips. Lean to your left. Any pain there?
Nope.
Okay. Other side. Any pain there?
Nope.
Okay. Now let's go like this. Let's put your hands right here. Let's go into a squat, please.
Right when it gets about there, it starts
There.
hurting.
Okay. Come back up. Let's do a couple more, but just not as deep. Does that feel a little better?
Yeah, just stop before it starts
Okay,
hurting.
good. You can stop there. That's fine. Thank you. Now, one last thing. Let's just bring your foot up like this. Doing okay with that?
Yeah.
Okay, let's try that leg. Okay, you can go ahead and stop. All right, thanks for doing that. Go ahead and have a seat on that table. We're going to start on some testing for really the muscles in your hip and knee, and then also, you know where that going, you want? Okay, thank you. And then also see how much your joints will move, okay?
Sure.
So the first thing that I want you to do is go ahead and kick your leg out to about there. Okay, I'm gonna push, don't let me push down. Okay, good. This one too. Okay, good there. Go ahead and bring your knee up. Okay, don't let me push down. Okay, good there. Same thing here. Okay, good. All right, so I'm gonna take this device here. I'm just gonna place it right here. And so I want you to go in like that as far as you can go, okay? Is that painful?
A little bit.
Push a little bit more. Doing okay there?
Yeah.
Okay.
It's a little stiff.
Yeah, it feels a little bit stiff. Now let's go out now. As far as you can go. You pain with that?
No.
Okay. Go a little bit further. All right, let's try this side. Same thing here. Go. Let's go in as far as you can. Doing okay with that?
Yeah.
Okay. Let's go out as far as you can. Okay, very good. Thank you. And then one last thing, I'm gonna have you stand up again one more time. All right, I'm just gonna feel around your hip a little bit, just while you're standing. See how things are aligned. So you can just put your hands up if you want to. Maybe touching on the front and back. Okay, go ahead and march a couple times. Thank you. You're good there. Okay, around the back, same thing. Okay, you're okay there. All right, and you can go ahead and lay on your back, please. All right. And by the way, I'll be doing all these tests on the unaffected side first, but for time's sake, we're just gonna go through his affected side. All right, so the first thing we're gonna do is just come here. Is there any pain with that?
A little bit.
A little bit, or just in this typical
Just in
spot?
that front area.
Okay, I'm gonna push a little bit more. Doing okay there?
It hurts a
That's
little
worse,
bit.
that's worse, okay.
Yeah.
Alright. Okay, I'm just gonna move your joint a little bit, okay? So just try to relax if you can.
Oh, right there.
Right there hurts,
Yeah.
okay? I won't go back to that point as much, okay? You're fine down here?
Yeah.
Okay. Bring your foot. Can you put that over your leg? Alright, don't let me push down. Alright, right there. Now, I'm also gonna put my hand just right underneath your buttock, okay? Let's raise it up. Just relax if you can. Any pain with that?
No.
No? Okay. Let's bring your leg down. Alright, I'm gonna push here.
just where you're pressing.
Just where I'm pressing. Okay, I'll adjust my hands. Is that okay?
A little better, yeah.
Okay. Alright, now let's bring your knee into this position. Okay, I want you to hold it up right there. And go ahead and drop your knee down as far as you can go. You okay with that?
No.
Push a little bit more. Okay, can you bring your back of your knee to my hand? Good. Alright, push a little bit more on it. Okay, you're good there. Alright. Okay, so I'm going to bring it back towards that painful spot. I won't go so hard, but I just want to make sure you don't have anything else going on in that hip joint, okay? You pain with that?
No.
Okay. Any pain with that? No, that's fine too. Okay, great. And you also said no knee pain ever, is that right? Okay, very good. Now let's do this. Go ahead and lay on your side for me, please. It doesn't matter which one, you can just roll to the side, that's fine. All right, I'm gonna bring you up into this position. First, I want to rotate this out. Hold that there. Don't let it drop. Does that hurt?
Mm-hmm.
It does a little bit. Okay, where does that hurt?
Right here.
Same spot. Okay. If we turn your foot in and hold it there, does that hurt?
No.
Okay. Can you hold it there while I push a little bit? Okay. Doing okay there?
Yes.
All right. I'm also gonna just put some pressure down. Okay. Let me know if this hurts. You pain with that?
No.
Okay, and I'm just going to feel around your hip a little bit to see how the muscles are doing. Any pain through this region?
No.
Okay. Any pain up here?
No, it's more on the side.
Okay. Let your knee bend. Okay, I'm just going to put some tension in here. How's that feel?
That hurts.
That hurts? Okay. Same spot?
Yeah. Right in the hip area.
Okay. Go ahead and roll your stomach for me. All right. Okay, so I want you to bring your leg up as far as you can go. All right, I'm gonna push a little bit more. Okay, any pain there?
Little bit.
A little bit. Same spot in the front hip?
Yeah.
Okay. Go ahead and hold it here. Don't let me push down. Okay, that's fine there. All right, I'm going to push my hands just right in this region, okay?
Okay.
Any pain with that?
No.
All right. And then, let's see. Last thing, I actually want you to just come like this right here. I'm going to pull on your foot. Don't let me, okay? Hold, 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 hold. Any pain there?
No.
Okay, very good. You can go ahead and sit on up whenever you're ready. All right, Emma, so with your hip pain, you know, it hurts a lot when you're coming into this position all the way. Your muscles are strong, so I don't really think it's an issue with the muscles themselves, but there is some tissue in there that will get inflamed by the tendons running over them. And I think that's what's going on in your hip.
Okay.
So it's going to hurt a lot here. It also hurts when we stretch it. And so the first thing that we want to do to treat that is get it to calm down. A lot of runners don't like to hear this, but it might necessitate that you back off from running a little bit. We can program some other things in to progress back to training for your marathon. And we can also include cross training, such as swimming and riding a bike, so you can keep your same like cardiovascular health and endurance that you have. But in PT today, I'm going to just go through some gentle mobilization just to make that hip feel a little bit better. And then we're going to also work on some stretches that you can tolerate, and then start to do a little bit of strengthening and just see how you respond. So I'll set you up with a home program. I would like to see you for this condition for Probably about 6 weeks, but at 3 weeks we can reevaluate, see how you're doing. I'd like to see you twice a week, and since you're an active person, most of what we'll be doing is just getting you to calm down early, but then also giving you things that you can do on your own so that you can do it yourself instead of just relying on physical therapy. How does that sound?
Sounds great.
Okay, do you have any questions for me?
No.
Okay, thank you so much.
Thank you.